We might get started. So Tess, thank you for joining us, and I'll introduce you in a minute. But before we begin, this is our Entrepreneurs Hour, which is one of the sessions that we do here at the Smart Region Incubator. And before I start, I'd just like to acknowledge that I am hosting this session on the traditional lands of the Gomeroi people. I also acknowledge the traditional custodians of the lands on which each of our presenter and participants are joining us from today. I recognise their continuing connections to these lands and pay my respects to elders past and present and emerging. I also extend that respect to any Aboriginal people attending today. So if you have just joined us, you may not have heard me run through a little bit of housekeeping. We are recording today, and I'll just ask if you can pop your microphone onto mute for now. At the end, if we have time, we'll take some questions, and I'm sure Tess is really keen to provide any insights she can. So please unmute on question time. So for those of you who don't know, the UNE Smart Region Incubator is an incubator organisation. We're not a space, we're a number of spaces. We're spread right across the New England northwest of New South Wales, springboarding out of University of New in Armidale. So that's about enough of me. I'll continue on and introduce Tess Van der Rijt, and then I'll hand over to you, Tess. So Tess completed undergraduate studies in arts law and built a career in health policy and reform before founding Patient Connector, a health tech startup connecting patients with specialist doctors, allowing patients greater choice over individual healthcare. Patient Connector was acquired by Medinette in 2019, where Tess remained as CEO. Tess is now an advisor to startups with global early stage venture capital firm Antler. So thank you, Tess. I will stop sharing my screen and you can share yours.
Sure. Okay, give me 2 seconds.
All right. Perfect.
All right, can we see that?
Mm-hmm.
Perfect. All right, well, thank you so much for having me. Look, this is a pretty informal session. Basically, I'm happy to I'll be providing like a high-level overview of my story and essentially what I learned along the way, with the aim of hopefully making sure you don't fall into the same pitfalls or mistakes that I've experienced. There'll be lots of time for questions at the end, but by all means, feel free to jump in whenever you like. So for some background before I started in the startup and tech world, my background's working in health system policy and reform. So I spent some time overseas working with the World Health Organization in Geneva. I then spent some time working in anti-trafficking of children in Malaysia, back in health policy in Singapore, and then finally 4 years as a management consultant in Sydney, where I was specialising in health. I have a family of healthcare professionals and a number of surgeons. And so I've always had, an interest in the surgical space and the challenges that patients experience in that context. So like many, you think you know the space really well, but the penny really drops when you experience the problem firsthand. And for me, that was the challenge of finding the right specialist doctor. Doctors are pretty good at hustling their network. What happened, it was over Christmas one time, and my uncle became quite unwell. And so, the doctors all get together, hustle their networks, find a surgeon who can look after him over the Christmas break. But the challenge is that everyone was physically away on holidays. And so it was this scenario whereby my uncle, who was in a lot of pain, but it was considered elective surgery, had to wait weeks before he could be seen by a doctor and be operated on. And so for me, I'd read at a system level the challenges of navigating the system and finding a surgeon. But for us, it was the first time we'd really experienced it firsthand. So we're in the lucky position of being surrounded by doctors and not being able to find a surgeon. Then it must be, I thought, incredibly challenging for the average Australian. So the problem we were aiming to solve at Patient Connector was helping to navigate finding a choice of surgeon and upfront information on location, price, wait list, and their experience as well. So I started working on a solution and leveraged a lot of the experience and knowledge of those around me. I followed the running lean Ash Moya methodology, quite similar to, the lean startup methodology. It was great because, rather than spending pages and hundreds of pages worth, it was really making sure you honed your understanding of the problem, solution, market, revenue models from the get-go. What was really interesting is our target market of patients were people that didn't have friends and family who were doctors and who knew the system. And so for me, that's who I'm really surrounded by. So it was really hard to find people who were my target market, that I could find out if, really understand the problem from their experience, but also understand if the solution that we were proposing would be useful to them. And so I imagine myself, sitting at the top of a train station and trying to stop someone to do an interview, and thought that would just be absolute pits and also be not really good, useful use of time. So what I ended up doing was using Airtasker. So I put up some, has anyone here had elective surgery in a private hospital? And I think it was $10, $15 for a 20, 30-minute interview. And it was an incredibly effective way to really understand, because it was one-on-one conversations, but quite an efficient way to find and create focus groups. So I suppose my first takeaway is really think laterally to find the right people, like your exact niche target market, to make sure you understand the problem, and just as importantly, ensure that your solution is really going to be useful. So, for me, that was Airtasker. Another thing so I thought I had my tech all sorted. I'm completely non-tech. You learn a lot over the number of years through osmosis, but I really didn't know anything about running tech. And so I started off, a friend of a friend was helping to create the tech for me. It became clear pretty quickly that it was really, they thought they were just doing the prototypes, maybe a bare base MVP, and then they were out. And so I realized this problem early. A lot of people know, of course, is that once someone builds the tech, if someone else comes on board, often they prefer to use their own code from the get-go. So often they'll just want to scrap the tech and start all over. And so I realized this was a problem early on. And so really, nipped it in the bud early, because this person, of course, was going to be a major shareholder of the company. So that's one thing in hindsight. If you are not sure on, really clarify early, particularly if you're a non-tech founder, making sure what you think you're both getting into and what that partnership looks like. At this stage, we had received the New South Wales MVP grant and a small amount from friends and family. And so I ended up going to the market with specifications of what I was looking for the MVP. So I said no knowledge about this space. So when I don't know what the answer is to a situation I'm in, I sort of go for a scattergun approach. And I sent the same specs out to 7 different dev agencies or individuals, all of whom someone had referred me to. So they were warm, leads. And I got responses back from, $4,000 to $170,000. And I can do this in 4 weeks to this will take 18 months. And slowly, someone tells you can't do it this way for X reason. And then I'd take that information and test it with the next dev that I spoke with. And so slowly over time, you realize that there were a few people that started to agree with each other. There was the middle ground for how long and how complex the tech was. And so for me, that's the most effective way when I'm completely in the dark as to what to do. Really sort of go to market, explore, get everyone's opinions, and then from that consolidate and form your own judgment. There's so many war stories for non-tech founders trying to find the right tech partner and having that relationship last. So I really, really say to spend the time to find that person and make sure you're both crystal clear on what the mutual benefits will be and the expectations for both parties. So we launched a market, Patient Connector, and we had some really good publicity from the get-go. Funnily enough, it came through the New South Wales MVP grant. It was picked up by the Sydney Morning Herald. I mean, the problem around finding a surgeon and long wait lists was really, hot topic in the media. So that was a benefit to me. And so these interesting partnerships came up, and one was with a private hospital group. And the private hospital groups, they were on my, 3-5 year plan for what I really wanted in a partner. So I was absolutely ecstatic that we already were launching and a private hospital group was wanting to work with us. What was very interesting is as we came through, I actually realized that there was a bit of a values misalignment in terms of the solution and the role that surgeons played in that solution. We didn't agree on who, the contributing factors to the problem, I'll put it that way. And the other thing is their long-term plans for the tech. We sort of planned to go this way, and I then through conversations heard that they wanted X and they wanted Y. And so it was a really big decision, but we ended up actually canning the partnership before anything had been formally signed. And it was a really hard decision because when you start out, of course, your biggest challenge is, how do we get revenue through the door and credibility? This was going to be amazing for credibility, being able to say to market, we have partnership with this private hospital group. So it was really hard to step back from that. But I'm so glad with the benefit of hindsight that we did, because really what would have happened is we would have become a dev agency for the private hospital group, and we wouldn't have been able to actually follow what our vision was for the company. So I think, before you partner with anyone, really make sure that you invest the time understanding their long-term aim for the tech, because if you don't align with what the features they're thinking they need and what you need, really you risk becoming a dev agency or otherwise having a very unhealthy relationship. So after we built the tech, we launched to market, and we had some really good success short term. One of my biggest blockers was in the Australian healthcare system, of course, to see a specialist doctor, you need a GP referral. So we had a lot of patients coming to us wanting to see a specialist, but it wasn't appropriate for us to pass them on unless they'd seen a GP. So I realized one of the ways to block, to mitigate that issue for the company was to create a partnership with a GP group. So there was one day I was pitching, was a finalist at Australian Healthcare Week, and I also had a booth. So they're massive days, as we know, 10 hours of talking to people, being really excited and high energy. And I felt as sick as a dog. My daughter hadn't slept, who was, 1 at the time. She hadn't slept all night. She had a really bad case of hand, foot and mouth. And I just really didn't want to go. But I pulled myself out of bed. I'm embarrassed to say I actually had hand, foot and mouth and didn't know at the time. First child, you don't realize. I thought it was a disease that stays with the kids and adults don't get it. But I'm happy to report that apparently I wasn't infectious at the time. Imagine, spreading hand, foot and mouth at Australian Healthcare Week. But look, I did the pitch. I didn't win. I was like, so glad this day is over. I'm out of here. And this person came up to me and said, handed me a business card and said, I'm really interested to talk with you. I'm in the GP space and there's some really interesting tech being developed. And we're looking for a partner in the specialist healthcare field. And it was actually this person that completely changed the course of the future of the company. There was a very strong partnership that was proposed, and that was all going on path really, really well. And then in fact, that's what turned into the acquisition. So it turned into an acqui-hire where me and my management team came across from Patient Connector to run what is Medinette. And so I think the takeaway here is, yes, your time is precious and you do have to choose when you are doing meetings and when you're actually getting work done. But no meeting or pitch for me has ever been a waste of time. Even if there's no revenue opportunity or partnership opportunity, or that comes out of it. You might learn something as simple as the way that person asked me those questions was incredibly effective at getting information that I didn't think I was going to be providing in that meeting. So for me, you can always learn something from a meeting, and none is ever a waste of time. So as mentioned, I then came across as part of the acquisition and became the CEO of Medinette. So in a nutshell, Medinette is a GP telehealth platform that provides 24/7 access to GPs. Now we all know what telehealth is because of COVID, but what's really unique about telehealth is from the doctor's point of view, it's not like just, a video and some FaceTime capabilities. The doctors can actually generate a prescription within conversation, and that is immediately accessible to the patient. And then that patient can either take that script where it gets electronically sent to a pharmacy of their choice, or the medication is delivered to them. Same goes with specialist referrals, where then Patient Connector was the product that provided all of that transparency of information. They could do medical certificates, really any reason you see a GP, that medical document and that service can be provided online. So it was a really big beast compared to Patient Connector, because Patient Connector was just dealing with the specialist healthcare field, but we were now doing pharmaceuticals, we were doing medical certificates, we were doing pathology. And so the tech had been developed, and well, it was in development, but we weren't really officially in market. And so there's a lot of conversation where a lot of people say, just launch as quickly as you can. And I do agree with that. I think that there's a very big risk of becoming a perfectionist, and eventually nothing's ever perfect. So people get nervous about launching. You're told, of course, that it's the best way to learn, go to market, find out what people think of your product. And really the only way to really find out what people think about it is for them to, of course, use it, but also have a feel for, if you have a partnership in the pipeline, or you already have a partnership in place. Like we already had many GPs willing to use our product. So make sure you don't burn those relationships early if you don't have the tech right as well. So what I'm saying is, you really need to find that happy medium about launching, because of course, if a patient, we've all got so much choice now. If you use a product and it doesn't work well the first time, or the UX is terrible, pretty much you're going to delete it and not use it again. You're not going to think, oh, I'm going to go back in 2 months' time and see if they've improved their product. So you really need to find that happy medium between knowing when to launch and knowing when to, essentially determining your risk appetite. So for us, we had a lot of data to work with, which was fantastic, and it was so useful to learn where to really focus on our product roadmap. So we saw, for example, that we were predominantly being used for pharmacist use, or general advice in after hours, of course, because your regular GP is closed. And our takeaway was that there wasn't really a lot of demand for pathology. So that told us, as an example, that we can put that further down on our product roadmap. The other benefit of launching when we did is we managed to establish a partnership with Medibank. So we were solving a really big problem for them, whereby international students, they have to have private health insurance to be in Australia. But a lot of them don't have GPs and primary healthcare in their home countries. So they would have the flu, for example. This is pre-COVID, another world, but they would have the flu, for example, and turn up to emergency, not realizing it's more appropriate to go to a GP. And for the private health insurers, it was costing them a huge amount of money to be looking after these patients with the flu in the emergency department. So why we had such success with Medibank early is it was costing them a lot of money to be looking after these patients in emergency and not in a medical practice. So we were solving a big problem for them. So the point I'm making here is try and find partners where you're considered a pain relief as opposed to a vitamin. And for those who don't understand that or haven't heard that term before, you want to be, a vitamin, of course, is a prevention. It's something that if you don't take it one day, you're not going to feel the ramifications immediately. While if you have a chronic headache and you don't take your pain relief, you will feel the ramifications within hours. And so you want to be looking for partners that consider you a pain relief and not a vitamin, because it's one thing to sign a contract to do a partnership, but the actual implementation can be bloody hard, and for both parties, but particularly for your partner. So if it becomes too hard for them, then it really will fall to the wayside, and all of that investment you've made in terms of your tech and developing the integrations and APIs can often come to nothing. So really make sure you're a very valuable partner. So we were in market a few months and then COVID hit. And look, it was a unique scenario for many businesses in healthcare. But for us, I mean, I really understood that COVID was a serious thing. It was a few weeks before Australia went into lockdown. And the reason I knew is because there we were in, you know, before Christmas trying to sell to these GP groups, and they were thinking, oh, you know, telehealth tech in healthcare, like nice to have, not sure. And then suddenly we were getting calls saying, can you please transfer our, you know, multiple practices with hundreds of GPs over to Medinette ASAP. And so that was really, I would say, you know, you building the plane while it's flying, because, you know, we didn't have efficient processes for onboarding whole medical practice groups, because simply put, in terms of the priority list, we didn't think that was a problem worth solving until we had such high demand. I told you 5 minutes ago that we thought pathology, you know, that's the least used aspect of our tech, so we don't need to build that out as effectively. This was the time when we didn't have the drive-through testing clinics for COVID. So every single patient, if they had any symptoms, they had to talk to a GP and get a pathology referral in order to get a COVID test, because the government thought that maybe they'd run out of PPE or the COVID tests. And so the demand for pathology went through the roof. And so that's what I mean by, you know, flying, building the plane while it's in motion. It was, you know, it was an incredible time. It was stressful for all parties really in Australia on various reasons, but it was just fascinating to see, you know, what you can do with, you know, when these sort of situations are put to you, and you really, it's a true test of your ability to pivot. And I mean, it was so fascinating to see how the sector also changed. I mean, healthcare is generally risk averse. I mean, there's a lot of good reasons for that, of course, because you're, you know, dealing with people's, you know, health and safety and ultimately their lives. But rather than going through these crazy due diligence processes and going up the food chain of approvals, I mean, as an example, Medibank wanted a white label for all of their users, all of their members, and you know, they wanted it within 2 weeks. So it was just incredible what happened in that time in health technology in the sector. So I mean, really our biggest problem at that time was really learning how to prioritize, and you know, we were setting up partnerships quicker than the tech could actually implement it. And so one of the biggest challenges was really being realistic with expectations and knowing when you can deliver and knowing when you actually have to say no. But look, we as a result of that, we you know, managed to help a lot of patients through COVID and a lot of practices and ensure their continuity of care. So we had 110,000 users in our first few months, and now valued around the 35 million mark. So yeah, my takeaway from that time is, particularly in my position, was knowing your priorities and sticking to them, but of course still being open to the unique opportunities around you. All right, that's me for now. I'll stop there. Happy to answer any questions.
Thank you so much, Tess. I'm just going to turn my video on. So everyone, please jump in with your questions. I guess I'll get the ball rolling a little, Tess. It's fascinating to see how so much of what happened was a little bit right place, right time. I mean, who could have predicted the COVID-19 pandemic? So a little bit of right place, right time, but then you really needed the ability behind the scenes to be able to grab those opportunities and run with them. And that's, you know, everyone, oh, you know, they were so lucky because this happened then, but you know, no one can take advantage of any of these opportunities if they're not set up well to respond to them. So what do you think were the really valuable things that you had in your team or in your processes that meant you really could grab these opportunities and run with them?
I think a good example is, as I said, we hadn't really built out the pathology capabilities. But then when COVID hit, we needed to develop them ASAP. So it was already knowing, like having the clinical knowledge and expertise around what's required. So there were a lot of GPs providing input already into what the tech required to be useful to the GPs and make it as efficient as possible, but also to ensure that the patients are able to present at a pathology lab and they're not turned away because something's missing. I mean, something as simple as if, you know, the date of birth isn't on there, then it's not, you know, has all the requirements. So I think there's definitely, and I mean, in hindsight, there's decisions that I made that was the wrong decision. Like, you know, we thought we're going to chase this piece of tech, and it ended up, it was valuable for say 4 weeks, and then the whole thing pivoted again. So I didn't nail it is probably the main thing that I'd say. But it definitely having knowledgeable people who really understood the healthcare system was of great benefit to us. And to be honest, there were times, I mean, someone had contacted me. She was a nurse in London, wanting to move back to Australia. Someone forwarded her CV and said, this person looks interesting. And I sort of looked at it and said, yeah, it looks interesting. We're not hiring. She ended up, like, I hired her when, you know, a week after I was like going through my email saying, where's that woman? She looked pretty good. I mean, we hired her after me speaking to her on you know, online for an hour, and she hadn't met up. It was 2 months before she met anyone. So part of it was also, she was, you know, a nurse, but had a lot of experience in operations. So I suppose, you know, keeping relationships warm as well, and realizing what skills you need, and knowing when you can just take a risk and employ someone and get hands on deck. And I mean, she ended up being one of our best hires. Yeah, look, benefit of hindsight, I don't think I nailed it though, really.
So we've just got a comment in the chat, and I don't think anyone really nails anything behind the scenes, do they? So from Nicholas, so there was an extraordinary surge in usage in such a short period of time. Did you face any major challenges with the tech being able to handle this surge? And were there any lessons learnt with managing the associated costs from that? And then Nicholas goes on to talk about some of his experience that, you know, tech startups find their AWS and cloud hosting bill quickly spiraling out of control.
Yeah, so we use AWS. Unfortunately, my answer isn't helpful for other people. What it is the reason it's not helpful is because I had a huge amount of credit with AWS through a few memberships and portfolio groups I was with. So I was with, you know, Heads Over Heels, for example. I mean, there are a lot of, you know, incubators and what have you. I mean, something that maybe UNE could explore, that they do provide AWS provides a lot of credits to incubators and startup programs. And I think it was through being involved in a number of networks, I did have a number of credits that we utilized. In terms of the actual, I mean, it held out, the tech, so that's like a relief to say. Probably the worst part was actually the number of releases we had to do, and the fact that the auto upgrade wasn't working. So we had the patient app and the doctor app, and we really needed to get both parties to upgrade at the same time for the tech to work. And the pace that things were moving, like we were doing releases sometimes every 10, 12, 14 days. And it's not because we were being silly and not being organized. It was actually that, I don't know if you're, following, so Medicare, it took the Department of Health, they did 5 iterations of releasing the Medicare item numbers for telehealth. And so it used to be only in X circumstances, then by the 5th release, it was any GP consult has a Medicare item number. And so if we didn't release them, say on a Sunday, the whole country is told that now you can speak to a GP for free via telehealth. And then if we didn't have that ready, patients get frustrated, said, this should be free. Why are you still charging my credit card? So we had to move so quickly. And it was actually the upgrades and all of that. That was our biggest hassle. Not to mention, I know it's really annoying. I hate it when I'm using an app and, I'm constantly being told I have to upgrade the app and go to the app store. So that was probably the biggest hurdle we actually faced in terms of the tech development at that time.
There's a question from Matt. And I find this really interesting too, from a regional perspective, being a regional incubator and trying to solve some regional health problems as well. So Matt's question is, where do you see the future of telehealth once the life comes back to normal?
Mm-hmm. Yeah, good question. So, look, from there's 2 sides to that coin. And for some context, I'm from Wagga, and a lot of my family members who are doctors are in Wagga, or, pharmacists, for example, are in Wagga as well. There's 2 sides to that coin. There's the patients. So I thought with Patient Connector, it was really relevant for helping people in regional areas. So as an example, there might be 2 certain specialists in Tamworth. They have incredibly long wait lists, and there's a patient in pain, and they could find out that there's a specialist in another regional, say Armidale, that has a shorter wait list, or even in Sydney that has a shorter wait list. So that patient then has more transparency and more choice as to, do I wait for the person locally, or is my pain such that I will go to Sydney or Armidale or another place? So from patients' point of view, I think telehealth is really important in terms of providing better accessibility and better choice. The other side of the coin, though, is, of course, if you're a medical practitioner and you're, say you're a GP working in not even a regional area, let's go like rural, where you used to have this huge wait list, and suddenly you've got these patients who are, now being able to talk 24/7 to a GP anywhere in the country. That creates a really hard viability for that medical practice in that rural town. So, a lot of the time the GPs actually get their money from the boring cold, it's the traffic and the boring cold and the repeat prescriptions. That's where they can get some quick money. So they still stay in that rural area and are available for you when you need a minor procedure or some more complex care. So their argument is, if all of the simple cases, such as, the prescriptions and what have you, are being sent to the cities, it makes the viability of their business challenging. And so it can actually result in a bit of a brain drain for rural areas. So I do understand the context of both parties. I think that there are still opportunities for, for the GPs in the rural areas to increase their business, so they could even have a greater outreach, not just those people from 2-3 hours, but speaking to people even more remote. So for me, it always comes down to patient choice and accessibility, and I do think that telehealth provides really great options, particularly when it comes to some really specific subspecialties that doctors in rural areas or regional areas might not have all of the answers. There's much better collegiality via telehealth, and that's even proven in a hospital context.
And Tess, what about telehealth in a metro area, where there's when you're not in a lockdown situation? what direction do you see telehealth going in a metro area where there is a bit more accessibility to medical professionals?
So I'll answer that question in the context of, let's talk about the world pre-COVID, which is actually, you know, when we launched and when the company was being created. It was about convenience and accessibility. So target market was so me, I'm a target market. It's 9 o'clock at night. My child is, you know, crying, has a rash. I'm thinking, do I have to take my child to emergency, or is this actually not you know, an emergency situation? The GP is closed. So what you can do is use telehealth, use the video, show them the rash. The GP can ask all the right questions, and maybe you find out that, you know, it's completely appropriate to just apply X medication or X cream. And then again, you can get the prescription, use a late night pharmacy, or have that medication delivered. So there's a lot of, you know, people who need care that when GPs are closed, you know, weekends and evenings. And of course, there's the other side of the coin. There's people who are willing, like, time equals money. So you're in, you know, usually you see a GP over your lunch break. You might be in the wait room. The whole process takes an hour. Then you go to the pharmacy, have to wait for the medication. You could otherwise do that conversation at your desk, or, you know, in a private meeting room. Takes 20 minutes and get that medication delivered. So it's a lot more efficient for patients as well. So really, convenience and accessibility in metro areas in a pre-COVID world was the value prop that we were providing.
I'm just gonna keep sprouting questions. So if you've got a question, please jump in the chat or interrupt me. You touched a little bit on this. Actually, before I say that, I just want to go back for some people who are either on the call or will watch the recording. Just to backtrack a bit, AWS, Amazon Web Services, for those who don't know, that's what AWS is. So just, you talked a little bit about risk strategies, but I want to go back to, you know, launch as quickly as you can. That whole, do I wait till it's perfect or not? What are some of the key risk strategies you think people can put in place so that they can get that balance right, but have, you know, a few levers they can pull if they've missed the mark a little?
I think it's important to set up manual workarounds. So as an example, when we launched Patient Connector, the user experience for the patient would be, they made a submission, they received an email with choices, they clicked a button and it said, I choose this doctor, and, you know, everything seemed really seamless. What was actually happening in the background was, in admin, they receive a, you know, notification that an email had been sent. We were manually inputting the information for that email to then be sent back, which looked beautiful from a UX point of view, but the reality was, in the background, nothing was automated. So it's those sort of decisions, because imagine we built out that beautiful automation, and then a lot of people get scared of launching, and to be honest, it's absolute crickets. You know, so it's not that you launch and you know, suddenly you're engrossed in operations. You know, launch and slowly you can build up that base, and it's also, once you've got something in the public, it's so much easier to have those conversations with potential partners, rather than showing them like a screen of, this is what it's going to look like, I can't show you it just yet. There's so much more credibility if it's something that's publicly accessible and they can share with a colleague. Yeah, I think it's working through all of the different processes and just ensuring that you at least have a manual workaround, so the experience for the user is still a positive one, even if that means that in the short term there's a lot more manual work involved for you.
How big was your team at the time that you launched, Tess?
For Patient Connector, it was me and, so there was two sort of devs, one full-time, one sort of part-time. And then I had two nurses who I was employing casually to help with like operations stuff. So that was really on a needs basis. So yeah, really pretty lean really. With Medinette, when we launched, I think there was sort of 4 devs and sort of 8 in the broader team. I mean, that was a different scenario, because when I say launch, there'd been a lot of beta testing with medical groups. So, you know, there was already a lot of feedback and a lot of groundwork and work going on before the, you know, official launch as such.
Yeah, sure. Which probably ties in quite nicely to another question from Nicholas in terms of beta groups, etc. So Nicholas is asking, obviously nobody could have predicted COVID-19. However, prior to the launch, were you able to gain, and sorry, I'm not sure if Nicholas is talking about Patient Connector or Medinette here, but prior to your launch, were you able to gain a confident understanding of your market size and opportunity? What was your own view of the job to be done that your platform was designed to do? And did this differ from how you've witnessed it actually being used post-launch?
Okay, so the first question was, understanding of market size and opportunity. So for that one, I mean, look, healthcare, there is a lot of data available. Not every sector, I mean, more and more data is available, I suppose, but I went for the you know, the blue sky and then sort of broke it down like, you know, I've forgotten it. This is what happens when you go on maternity leave. Tam, Som, Sam. So you've got, you know, what's your total addressable market, which is for that was, you know, how many GP practice, you know, consultations are happening every single year. And then how many of those do you think you could actually target yourself? Or how many would use telehealth? And then of all of those who use telehealth, how many do you think you as a company could capture? That's sort of an effective way that it's really, you know, putting your finger in the air, but start with the most useful piece of data that you can find at a macro level, and then really break it down to get an idea of you know, who your market is, and what that market opportunity is. I mean, we could use, in terms of the revenue numbers, we can use MBS item numbers, make assumptions as to what people are willing to pay privately. So again, sort of health, there was enough data for us to work with to make some assumptions. In terms of how it was used, we are sort of user journeys and stories. We imagined, you know, the anxious mum late at night, worrying about their baby or toddler and how sick they were and if they needed to go to ED. We had, the busy corporate who time equals money. I mean, I'll admit we did have some issues of people trying to use it for you know, drugs that are of street value. And I mean, they're pretty easy to quash, but we certainly did see that happening. So again, it's the benefit of having a lot of doctors and pharmacists involved in the team, whereby you nip that in the bud very, very quickly. But it's certainly something we saw, particularly over the Christmas period for some reason. Otherwise, of course, no, it really, who we assumed was going to be our target user was who our user was. We did definitely have a lot of the parents. But of course, COVID then just changed everything. It was then suddenly every man and his dog. What we learned though was, again, it was sort of who were our GPs who were users. What we learned over time was our best GP user was a mum or dad who was on parental leave, whereby it's one of the few workforces left that can't work from home, who are doctors. So our sell to them was flexibility in the workforce that everyone else can have but you. So a lot of GPs work part-time, and so say for example they were looking after their child on a Tuesday, they can't work a few hours here and there and jump into the practice and what have you. But what they love doing is they put their child to sleep, go online for a few hours, do a few consults, make some additional money, and then just take themselves offline when their child woke up. So that became our like ideal user from the GP point of view that we hadn't really anticipated before we launched.
It's interesting to see those two users, the patient and the professional, and how COVID really drove that need for the GPs to have a solution very quickly, because there was a service to be delivered, and also their own staff and their own practice management to be protecting from purely a WHS perspective as well. So yeah, fascinating.
Yeah.
Times that we are not through yet.
I was going to say we're back there with the pharmacies and medical practice groups being one of the main places now where the virus is being transmitted.
Absolutely. It's it's interesting watching that from a regional area and looking back at metro areas and saying, wow, this is sort of quite close to us and could happen at any time. Previously, I think we felt a little bit insulated as we were coming out of lockdown. So we've just got a couple of minutes left. So if anyone else has any questions, please go ahead. I want to go right back to the beginning, Tess. Like, as a founder, personally, how did you kind of manage some of the knockbacks, or not so much just the knockbacks, but some of those disappointments? You talked about the partnership that almost was, but then it wasn't a right fit. Founders invest a lot into a particular path, or a particular solution, or a particular strategy. Personally, how did you deal with, every time that didn't work? How did you get up and keep going?
It's hard. So there's no denying that. I think the amount of times you get told you have to be really resilient to do startups, but it is true. I think I'm actually not, I generally sort of, my answer to that would be have people that you can talk to, who you, even better if they're not actually that involved in your business, but you just respect them from a business point of view. And some of whom who have run tech, and then some who don't do tech at all, because it's quite interesting. They're the different perspectives of what you're dealing with. For some reason, there's just, how you run a business, it's so different if it's completely tech enabled versus, a small business that, has a shop front, as an example. So I found the right people that I could confide in and be really honest, because the other part that I find really challenging is you're supposed to always be on. You go to these cocktail party or this, pitch thing, and someone says, how are you? And you're supposed to, be ready to say this elevator pitch and be selling the dream at all times. And sometimes it's, it's really fake after a while, and it's really, it's a bit grinding when you've had a terrible day, and then you're supposed to go to this thing and tell everyone how amazing life is and how your company's killing it. So to be honest, there were times when I didn't do my elevator pitch. I just was really, really honest. And I said, you know what, it's a bit challenging at the moment. I thought I had this partnership, realized I can't, it's not the right thing. So now I'm really worried about, getting traction. And I actually found that being honest ended up that you had the best conversations with people, because they always had their own war story, so you could learn from each other in that way. And B, that person potentially actually comes an investor. They know you're going to be honest with them, and they're actually intrigued by you because you've sort of shown a chink in the armor, and the next time they see you, you've probably found a way to resolve it. So, if you need to be honest and don't do the sell, then don't do it.
How do you think, founders as a cohort can support each other? Because you're all in that environment together.
Yeah.
What are some of the things you think that founders can do to decompress a little and say, hey, let's just blah about what's going on?
I do really think the honest conversations is so important. particularly because you're, as I was saying, you're told you have to be on when you're going to these events, and you're at the pitches and at these booths and business opportunities. You're always on. So I think honesty is key. And I mean, you see it in mothers groups, where it used to be that you're trying to, my child's sitting first, my child's this. Now I've seen this change of attitude where people are sort of almost being disparaging about themselves as a mother, and obviously putting yourself down isn't the answer, but it's more about that honesty and, holy shit, I have no idea what I'm doing. And it's through those honest conversations where you actually are more supportive of each other. And I think when you break down and then having those really deep conversations, that's when you can sort of brainstorm the best solutions as well. While if you're trying to always be on, then you're not really ever telling the whole truth. And so you're not even unpacking the problem yourself through that brainstorm. So, I mean, I'd say, yeah, be honest with each other, talk about the bad times as much as the good.
One more in the chat, which we've got a bit of time for. Again from Nicholas: being a non-tech founder, did you find it very hard to manage the tech development process? In your opinion, should a non-tech founder engage a CTO or similar specialist early to help manage the dev team?
Really, really good question. There's so many war stories from non-tech founders. And I mean, as I said, like, I was really close to being one of those, and I'm really glad I sort of realized the problem early and got on top of it early, rather than sort of putting my head in the sand and thinking it'll sort itself out later. I do think if you've got multiple devs, there has to be one. Yes. My answer is yes. You need to have one person you absolutely trust. I mean, I found that person. So I said, like, I sort of went to market, spoke with 7 different people. I mean, a lot of it's just you following your gut, but I chose this particular person, and he came across to Medinette with me. Like, we were through the whole process, we were together. And I could always trust him. And so as the team grew, as people, the whole team, a lot of the devs changed and grew with Medinette. And so I can't look at the code. Like, I don't know who's telling, someone tells me that this is perfect and will be ready to launch next week, and then someone else comes up to me and says it's 2 months away. It's really hard. You don't know what, the risk is huge. If you're launching something and releasing something that's not ready, it has massive repercussions. I mean, if you're telling a partner you can have something done in 2 months and it takes 6, like, that's really bad on the reputation of the business. So you do need that person that you trust. How you find that person, it's really hard. What was effective for me was actually going to market with multiple specs. So you've got at least an objective thing that you can put forward in front of multiple people and judge off the answers, who you think, by your gut feel is the right answer. By all means, of course, ideally, if you have any friends who are tech that can look over some things for you, that obviously would be ideal as well. But not everyone has that luxury.
And checks and balances, Tess, in terms of, there is like that gut point. What kind of checks and balances along the way help you to identify those issues early?
Sorry, which issues? Sorry.
If things aren't going right with your tech team.
Oh, right. Yeah.
What kind of things should you always be thinking about, just to keep tabs on that so that you can nip it in the bud early as you do?
Yeah. So I think, one, in terms of like releases, your job is often to be looking at like strategy and long-term partnerships and opportunities. Stop all of that before any launch and get in the weeds. Like, you need to be the main tester of anything before it's released to market. So you might have said, this is what the business needs, but unless you've been really clear in your specs, which, I mean, I'm going to say you should be, because if you're not clear, then devs are making assumptions. You know, do it right the first time. So, but what my answer is really stop and go in the absolute weeds of being the user testing. Like I would act up the GP, I would act up patient. I spent so much time testing before anything was launched, and still again things would then be launched and it wouldn't be perfect because something happened along the way. But I really think you need to stop and get in the real weeds until you have, you know, you can employ a user testers and product managers, but even then it's, you know, it's your company that you're responsible for. So take the time and stop before anything is launched to market. In terms of checks and balances, in terms of say relationships and equity sharing and what have you, yeah, look, I particularly if you've got good traction and things get busy, it's quite often those relationships, you stop thinking about those relationships and just focus so much on the next, you know, iteration or what have you of the business. So I do think that making sure you step away, even if it's just once a month, with the, you know, say that the tech co-founder, and physically step out of the office or, you know, go to a new space. And so make sure you're talking, you know, about your relationship and about making sure both parties are still happy. Because I think, yeah, that often falls to the wayside, and then you realize that someone's actually been disgruntled for a very long time. So, I mean, it's just nurture the relationship. It's like any relationship. It, you know, you've got to look after it.
We are nearly bang on time, and I think that's a really nice place to finish, Tess. Is we've just gone through 2 points about relationships, and that's about being open and honest with your founder cohort, and also, you know, building your relationship with your team, not just focusing on product. So in this time with so many people in lockdowns and partial lockdowns, I think that's a really nice place to finish up, and it makes sure that we're listening to each other and reaching out for our co-workers and friends, and keeping those relationships going in a particularly trying time. So Tess, thank you so much for your time. I really appreciate you coming on Zoom in your last little while of maternity leave, and giving up your time to talk to us. So I really appreciate it. Thank you so much.
No problem.